Everyone. My name is Lily. I'm the office manager at Community Health Resource Center. Thank you for joining today's community outreach presentation, Heart Health in Motion, sponsored by CPMC's Kanbar Cardiac Care Center. Today, we're fortunate to have Richard Constantino, an exercise physiologist from CPMC's Cardiac Rehabilitation Program, here with us to discuss the role of physical activity in preventing and managing heart disease. Before we get started, I'd like to just share a few words about the Kanbar Cardiac Care Center. It was originally founded in 2002 at the CPMC Pacific Heights campus and relaunched at the CPMC Van Ness campus in 2022. The center was formed by the generous contributions of the late Maurice Kanbar, who was an inventor, innovator, entrepreneur, but more importantly, a philanthropist. The Kanbar Cardiac Care Center is one of the highest ranking cardiac health facilities in California and offers an array of cardiac services and specialists who use advanced technologies to diagnose and treat patients with heart disease. Its nationally recognized physicians, surgeons, and clinicians are committed to providing excellent personalized care in a contemporary and welcoming setting. And just as a reminder, the information provided in this presentation is for educational purposes only and is not a substitute for professional medical advice. I would now like to pass it along to Richard to introduce himself and dive into the presentation.
Hello, everyone. Thank you for attending this talk. Thank you to the CHRC and the Kanbar Cardiac Center for allowing me to speak today. I just wanted to talk to you today about heart disease and the role of physical activity and exercise in dealing with heart disease. My name is Richard Constantino, as Lily had mentioned. I am an exercise physiologist who works here at CPMC as a cardiac rehab. And we take in a lot of the cardiac patients here at Sutter, as well as patients from other hospitals such as UCSF, Stanford, and SF General, who have had heart disease or heart problems that need rehabilitation. So I'm going to start my talk now, and we will answer questions here at the end of the talk. So first of all, I'd like to just start with describing what heart disease is. And basically, people have known it as cardiovascular disease also. It's a variety of conditions that can affect how the heart and the blood vessels work. And some of these terms you've heard before, either from your physician or from those who still have cable TV. You would hear them from TV commercials that have medications that are advertised. But first of all, we'll start with coronary artery disease, which is basically in the heart's major blood vessels. So those are the blood vessels supplying blood to the heart. Then we have hypertension, which is the pressure along the arterial walls. Next, we have congestive heart failure, which is ineffective pumping of the heart. So the heart itself is a muscle as well as a pump, which supplies blood supply to the rest of the organs and the different parts of the body throughout the body there. Cardiac arrest, which is sudden loss of heart function, so the heart just stops working. We have peripheral artery disease, which is reduced blood flow around the limbs. We have stroke, which is reduced blood flow to the brain. Arrhythmia, this is a term that is loosely related to irregular heart rhythm. And congenital heart disease, which is heart problems that develop when during birth. So while the fetus is developing, the heart doesn't develop correctly. So I'm just going to go through some numbers as released from the CDC a couple years ago. So these are not updated currently, but gives you a good idea of what heart disease is doing in our population. So the leading cause of death for men, women, and most racial and ethnic groups is caused by heart disease, which is surprising with also these numbers were taken during COVID, cancer, and all of these other diseases that are out there. Heart disease is still number one. Approximately one person dies from cardiovascular disease every 33 seconds. So that is pretty striking. But when you look at the number of people who live in the world, you know, that's quite a small bit, but it does add up really quick. 33 seconds, every one person dies. In 2022, 702,880 people have died from heart disease. And one of every 5 deaths was due to heart disease, so 20%. And the cost to treat heart disease, whether it be from hospital stays to medications and so forth, from 2019 to 2020 was about $252.2 billion. So next, I want to talk about the risk factors of heart disease. So these are the different risk factors that contribute to your developing the risk of heart disease as you go through life. So we have non-modifiable risk factors, which are risk factors you have no control over. So we have family history, gender, age, ethnicity, and then we have the modifiable risk factors, which you do have a say in how you control it. So you actually have a chance to change these risk factors. We have hypertension, hypercholesteremia, diabetes, obesity, smoking and illicit drug use, and sedentary lifestyle, and stress. So we do have control over these things in our life. So the question is, well, we know these risk factors. What can you do to control these risk factors that you do have control over? Well, again, there are risk factors you have no control over. So as far as genetics, those are passed down from your parents. So you can complain all you want to your parents, but remember, they still gave you life, so you wouldn't even be here, but they do pass down their genetics to you. So if you have parents who have developed heart disease when they were younger, like a parent who had a heart attack in their 40s, you are at risk of developing a heart attack in your 40s also. Males, like I said, gender plays as a non-modifiable risk factor. Males are typically at higher risk than females. As you get older, your risk of developing heart disease increases also, although we are seeing heart disease develop in even younger patients than we have in the past. As far as race, Africans, Caribbean, South Asian descent proves to be a higher risk for heart disease. So the risk factors we can control, things that can be improved. We do this by making positive lifestyle changes. So probably the toughest one to do is reducing stress and anxiety. As you know, especially living in the Bay Area, that's pretty tough to do. We're exposed to stress daily, whether it be work or just the environment and so forth. The cost of living. So stress is always part of our life, but we have control over trying to reduce that by making lifestyle changes to try to add rest and try to do things to kind of relieve that anxiety and stress. Quit smoking, or at least reduce exposure to smoke environments. So if you are a smoker, definitely quitting will make a significant difference in reducing your risk factor. Improving your diet. So these are kind of like the ones you really have strong control over. Improving your diet, whether it be eating less fattier foods, eating less calories, reducing portion sizes, which improves weight loss, can help reduce your risk factors. And of course, exercise. So exercise will also help with that, as I will discuss here in my talk. So I found this little comic here that I found pretty interesting. This is Snoopy taking a nap here and trying to wake up. He says, "Okay, gang, it's jogging time." And he's talking to his feet. His feet's replying, "No." And then he's saying, "Come on, we need to exercise." And his feet say, "No." And then he says, "I have very stubborn feet." And the feet keep saying, "No, no, 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 no." So I think a lot of us can relate to that, where the mind wants to, but the body doesn't want to react to it. So let's talk about the benefits of exercise. So as I said earlier, this is something that can reduce your risk of heart disease. And well, this is what studies have shown. So it helps reduce the risk factors of heart disease by helping with weight management. So staying active will help reduce fat and replace those fat cell stores with muscle, which is better use of in your body. Muscle weight is better than fat weight. Improves heart and blood vessel health by lowering blood pressure. So basically, when you're exercising, the blood vessels dilate to allow more oxygenated blood travel to the muscles that require the oxygen to work. And so when the blood vessels dilate, the blood pressure lowers. And that's what you want, is that kind of constant teaching of your blood vessels to dilate so that it relieves the blood pressure. Exercise reduces the feeling of stress, depression, and anxiety. Like I said earlier, stress and anxiety is a big risk factor for heart disease. It basically helps in increasing the endorphin production, which is the feel-good, basically the feel-good drug that the body releases to make you feel good. So that's why after exercising, people usually feel good afterwards. They say they have this feeling of euphoria. That's what that is that release of endorphins. And it also reduces cortisol and adrenaline production, which is what causes that stress and anxiety feeling. It helps with type 2 diabetes prevention by helping with how the body uses insulin to increase muscle absorption of sugar from the bloodstream. And what is an issue with diabetes is that those sugar molecules from what you're eating and your carbohydrate stays in the blood. So by exercising, it helps take that sugar storage out of the blood and being used by the muscles to work. It also increases HDL, which is the good cholesterol levels, and HDL helps remove the bad cholesterol, the LDL molecules out of your system, which the bad LDL particles adds the plaque into the arteries, which causes those blockages. Some other additional benefits of exercise includes lowering the risk of stroke. It also lowers the risk of cancer, lowers the risk of, improves quality of sleep, and lowers the risk of osteoporosis, which is the risk of the loss of bone density, and also improves your immune system. So your chances of getting sick, even from the common cold, are less if you stay more active. So let me just talk about or list the types of exercises that there are. We basically have three, and then I'll break it down one by one here. So first of all, we have cardiovascular exercise. People have known this as aerobic exercise. And that's the standard of exercise that we kind of all know about. Next, we have musculoskeletal exercise, which is basically strength exercise, strength training. And lastly, we have flexibility exercises or stretching. Lastly, we also have balance, which basically ties in with the strength training and the stretching. So they kind of tie in together. So first, I'm going to talk about the aerobic exercise. So aerobic exercise is important because it helps develop the strength in the heart. It gives you that heart health, right? So it increases stamina. These are the benefits. It enhances weight loss by burning fat and calories. It helps strengthen the immune system. It strengthens the heart muscle, which is kind of all this stuff that I had talked about earlier. And longevity, which, longer life, obviously, by exercising, doing aerobic exercise. So what are some examples of aerobic exercise? These are things you've heard of before, but in case you didn't know what kind of exercise this was, this is aerobic exercise. So walking, jogging, and running. We have biking. We have stair climbing. And we have swimming. So these are just some examples of what people do on a normal basis. These are all forms of aerobic exercise. And how do we know what aerobic exercise entails? Well, there's a few guidelines for that. So basically, first of all, you have moderate intensity exercise, which is done about 30 minutes of exercise 5 times a week. That's what's kind of wanted or guidelines that are pushed forward by a lot of governing bodies of exercise like the ACSM, which is the American College of Sports Medicine. A vigorous intensity exercise, as you can see, you can exercise at less time, 20 minutes a day, and less frequency, 3 to 4 times a week. So you're getting that heart rate a lot higher. You're forcing yourself to work a little harder, so you don't have to do it as much. And what you see is in aerobic exercise, you have an increased heart rate. You see an increased respiratory rate. And basically, when you do any kind of aerobic exercise, you want to entail in warm up and a cool down. So you want to start really easy before you start your exercise, and then you want to make sure that you cool down afterwards. You don't want to just stop and sit down right away. You kind of want to slow down a little bit, let your heart rate come down and catch your breath before you sit down and rest. And I'll go through a little more detail later, but I'm going to go ahead and talk about strength training now. So what are the benefits of strength training? Well, first of all, it helps make daily activities easier to do. So these are kind of things that you don't think about that you do every day, your activities of daily living. And it gives you functional independence. So people, as they get older, they want to keep their independence. They want to be able to still live on their own, take care of themselves. And strength training helps to allow you to do that. It helps you maintain healthy weight and reduce body fat. Helps increase bone density and lower your risk for osteoporosis. And it also improves your balance. So developing your muscles, especially in your lower body, in your back, in your abdomen, all helps with keeping your balance, helping you stand upright. Some examples of strength training that you can do. First of all, there's free weights. So those are things that you can buy at the store really easily, like dumbbells, bars, ankle weights that you can tie to your legs when you're walking. Those are example of free weights. So free weights are just things you can buy and use at home. Next, you have weight machines. So those are gym machines usually that are like cables that are attached to weights. The way those machines work is there's several stations attached to those machines, so you can work different parts of your body on one machine. They're a little complicated to use, so unless you're used to using them, you would have to ask someone in the gym the proper way to use it. And then you have resistance bands, which are very useful to use. You can find those at stores also. Another name for it are TheraBands. So they're just elastic bands that you can use. They come in different colors. Different colors are different resistance. So they're kind of equivalent to resistance as far as weight. So just like a 5-pound weight would be like a color yellow or a color green band. The advantage of using those bands are you don't risk yourself dropping these to hurt yourself as it would be lifting a heavier weight. And then you don't have to buy equipment. You can also use body weight as exercise for resistance training, such as doing sit-ups and push-ups or pull-ups on a bar. So just using gravity as your friend, you can also use that to do resistance training. So some guidelines for the strength training. Strength training is generally done only 2 to 3 times a week, so you don't have to do it every day. Generally, you would do 8 to 10 different exercises that target different muscle groups. So you kind of want to do your arms, your back, your shoulders, your legs. You all have different muscles throughout your body. So you want to target different areas of the body so that the whole body system gets a workout. And usually you'll do 1 to 3 sets, so and about 8 to 12 repetitions per exercise. So you want to do a weight, you want to choose a weight where you feel like you can do that without having to strain too much. Between sets, you want to make sure you rest about 1 minute in between. So it gives your muscles time to rest a little bit before you do your next set. Again, intensity should be moderate to moderately hard. If it's too difficult, you probably want to go down a level. And if it's too easy, you want to go up a level so that you feel like you're at that moderate level where you can perform those 1 to 3 sets with 8 to 12 repetitions without straining too much. Lastly, we'll talk about some flexibility or some stretching exercises. They can be done daily. They should be done before and after a workout. So it helps with warming up the muscles. So it prevents getting into any kind of injuries from any muscle pulls or tears because the muscles are too tight. So you kind of want to stretch them out before you do your exercise. It helps prevent cramping. So people have issues with cramping. Definitely you want to stretch before, drink lots of water. And then also increases the range of motion. So being able to reach down to tie your shoes, reaching up in the cupboard to reach that bottle or can, things like that, or twisting and turning to grab something, that's all range of motion. So flexibility and stretching exercises helps with that. So some examples of stretching. People will take yoga classes. A lot of yoga classes are different kinds of stretches. And of course, there's different levels of stretching that you can do in yoga. Doing a lunge will help stretch the hip area. A standing calf stretch. So basically just extending your leg in front of you and then pulling your toe back will help stretch your calf muscle, which is the muscle in the back of your lower leg. Pulling your knee to your chest helps with the low back area. That also helps with people who have problem with sciatica. Usually the hip flexors and the low back is the areas you want to target. Toe reaching, so just reaching down for your toes, or if you're sitting down and reaching for your toes helps stretch the hamstring area, which is the back lower upper part of your leg. And then reaching back with your arm just to hit your back, bending your elbow backwards, helps stretch the tricep area, which is behind your upper arm there. Some quick guidelines for stretching. You always want to warm up the muscles before you stretch. So kind of just move them around a little, get blood flowing before you stretch helps. You never want to stretch muscles when they're cold. You want to stretch slowly and then reach and then do it gently. And then you want to hold your stretches for about 15 to 30 seconds and make sure you don't bounce. You don't effectively stretch a muscle by bouncing. So you want to make sure you reach. And then once you feel that stretch, then you want to hold that stretch. A lot of people will forget to breathe when they stretch. They'll hold their breath and count for 15 seconds. And actually stretching can be done more effectively as you breathe, especially as you're exhaling. You can stretch a little easier that way. Again, stretch only to the point of tightness. Don't try to exceed that. When you feel your muscles pull a little bit, stop there and hold the stretch. Don't try to force yourself to do too much. Do not lock your joints. And again, don't stretch to the point of pain. And then remember to do each side. Remember, if you're doing stretching on the left, stretch the right also. You don't want to ignore both sides of the body. So a big question with exercise, a lot of people wonder, so am I on target? Am I doing enough? Am I getting the benefits of exercise, or am I not doing enough to get the benefits? So the first way to tell if you're on target is your target heart rate. So a lot of people will say, well, where's my target heart rate? So the way some people will get their target heart rate is to first find out what your age predicted maximum heart rate is, which is basically 220 minus your age. Once you get your maximum heart rate, then you can figure out where your intensity of your workout is. So a low intensity workout, your heart rate would increase about 40 to 60% of that maximum that you calculated. A moderate intensity exercise would bring you up to about 60 to 80% of that age predicted maximum. And then a vigorous exercise session would bring you about 80 to 95% of your maximum heart rate. So if people don't use that age predicted maximum heart rate, some people say, well, I'm on a beta blocker medication. So my heart rate is lower than usually where it should be. Then what people can do is they take their resting heart rate and then they just add 30 to that. So resting heart rate plus 30 is a general spot for a target heart rate if you're on a beta blocker or some kind of medication that reduces your maximum heart rate. Another way people will test if they're doing enough intensity would be a talk test. So while you're exercising, a moderate intensity exercise would allow you to talk to someone, but still not be able to sing. So you can have a short conversation, still catching your breath, but not to the point where it's very difficult to breathe. You can still talk and still breathe without having too much problem. And then a vigorous intensity exercise is where you can't say more than a few words without pausing for a breath. The next way we would test someone if they're in their target heart rate is using the RPE scale. Some of you have probably seen this before. Some of you might not, but it's basically a rate of perceived exertion scale. And I'll show you an example here in a minute. But basically a low intensity exercise would be an RPE reading of a 9 to 11. A moderate intensity exertion would be 11 to 14. And a vigorous intensity workout would be rated a 14 to 17. Now, the RPE scale is totally opinionated, so it's based on your perceived exertion, so how you feel. The trick of this is you have to be honest to yourself. So if you feel like you're exercising at a low intensity and you want to get up to a moderate intensity, you have to push yourself a little more. And then if you're exercising at a vigorous intensity and you feel like it's really hard, you might want to scale down a little so you're in that moderate intensity level. The moderate intensity level is usually where we want to target, where you want to target your exercise sessions, so that 11 to 14. Next is what we call METs. So this is called a metabolic equivalent of tasks. So basically, it's a table that explains where your activity level is based on the activity that you're doing. It compares different activities to other activities to other activities that are on that scale. I'll show you, and it's kind of confusing, but basically, some machines will give you a MET reading if you look at it, and you're kind of wondering what those numbers are. So sometimes you're on a treadmill at a gym or on a bike, and it'll give you a MET level. A low intensity MET level would be a MET level of a 2 to 3. A moderate intensity would be about a 3 to 6. And a vigorous intensity MET level would be a 6 plus. And I'll show you also a table of what these MET levels are here in a second. The last way you can tell if you're on target is counting your steps. So people who walk for exercise, which is a great form of exercise, measure your steps every day. An average adult should average about 8 to 10,000 steps a day, which is the equivalent of about 5 miles of walking. And then an adult, usually at above the age of 60, the goal is a little lower at about 6,000 to 8,000 steps a day. And for every additional step that you add, additional 1,000 steps is 15% decrease in mortality. So that's enough encouragement to get those steps in. The more steps, the better. So I'll show you this RPE scale I was describing here earlier. So as you can see, this Borg scale, these are those numbers I was describing here. That's that number to 11 is that light exercise level. That 12 to 15 is that moderate, and the 16 plus is that intense exercise level. So as you can see, a very, very light, and fairly light workout is on that yellow scale, which is on the lower side. The green is where you want to exercise, where it feels like it's somewhat hard to a hard workout and a roughly hard workout. And then as you get to that very hard and very, very hard exercise level, that counts as towards an intense workout level. So like I said, you want to kind of gauge yourself where you're exercising that green level, where you feel like it's somewhat hard to a hard workout. Next, I'm going to show you this MET scale. So as I described earlier, anything less than 3 is a light activity level. Anything from 3 to 6 is a moderate workout, and 6 plus is a vigorous workout. So what we say about the equivalence of exercise here, we're comparing different workouts with each other based on the activity. So like playing catch and walking 2 miles per hour are considered a light workout at a or playing golf with a cart, that's about a 2.5 MET level. Your moderate exercises are like dancing, snorkeling, kayaking, tennis, water skiing, ice skating, playing baseball. Those are moderate activity levels. And then your vigorous activity levels are the 6 plus, which is like playing football, hockey, little more physical stuff, skipping rope, playing soccer where you're consistently running, skiing, playing basketball. As you can tell, it's a lot more of the running exercises where it's stop and go, stop and go. Those are more vigorous exercises. So that's where the cor correlation is with those met level numbers. As you can see with those numbers there, you can kind of correlate with your med level on the treadmill or on the bike as to where it correlates with different activities. So where do you start when you want to exercise? Well, it always starts with creating a plan. So first thing you always want to do is consider any health conditions that you may have. So before you start an exercise program, if you're on the older side, you're not sure what to do, always consult with a physician first. Make sure that it's safe for you to start an exercise program, and maybe they might have some guidelines for you to follow. Assess your fitness level. So really you have to be honest with yourself. Are you a beginner? Are you in the lower level? Are you at a high fitness level? Are you exercising regularly? You love jogging, you like running. Are you at that high level? You like cycling. So you have to be honest with what your fitness level is. You can't just gauge it based on your age or how you feel. You have to kind of know where you're at and where to start. And if you're not sure, if you never exercised before, always start easy and then work yourself up. Always set realistic goals, short-term and long-term goals. It kind of works in conjunction with a diet, right? If you don't set those realistic goals, you'll tend to quit early. If your goal is to run a half marathon in 2 months and you don't start training right away, is it really, are you able to reach those goals? Probably not. So you want to start really easy, be able to at least walk a couple of blocks and kind of build on that. Walk 5 blocks, walk a mile, walk 2 miles, start walking up hills, but start really small scale and kind of build those goals as you go along. Otherwise, if you set goals that are too unattainable, you'll tend to quit. And those are what happened to people who join gyms right away with these goals of losing weight immediately, and they don't see those results right away. So set those realistic goals, be happy with all the little goals that you achieve and kind of work from there. Set aside time in your schedule. That's always everyone's big excuse, especially if you're working. There's no time. So whether it be getting up a little earlier in the morning, going to bed a little later, going during a break, doing it during your lunch, set aside at least a little time throughout your day to do some exercise. Keep your routine consistent. This is really important. A lot of people don't consider this, but humans in general we're creatures of habit. We always want to do the same thing over and over again. We are so used to repetition. So if you develop a routine that's consistent where you're always going to work at a certain time, you always take lunch at the same certain time, you always want to exercise at a certain time. So you know right when that time goes, your body is ready to go. You're used to it. You're going to go do your walk. You're going to go do your bike ride or whatever you're going to do. But being consistent is really important. Choose activities that you enjoy. Why would you go out for a bike ride if you don't like biking? Or why go out for a walk if you don't like your neighborhood? Do something that you enjoy. Walk or exercise in areas that you enjoy walking in. It just makes it easier and you don't dread it as much. So this guy, this lady was talking to her doctor and she says, I exercise almost every day, almost on Mondays, almost on Tuesdays, and so forth and so forth. So I just found that kind of funny that this is kind of like, oh, I do my exercises almost. So some guidelines to follow. We basically use this FIT principle. So first of all, the F in fit is frequency. So what is the frequency? Again, 3 to 5 days a week is at least for the aerobic exercise. The more aerobic exercise, the better. Again, for the strength exercises, 2 to 3 times a week. Intensity is the I. So you got to figure out if you're doing light exercises, moderate exercises, and vigorous exercises. You want to do that talk test, the heart rate, and the RPE. Time, 20 to 60 minutes per day, depending on the intensity. You can spread it out throughout the day. You don't have to do it all at one time. And then the other T is type, which is your aerobic exercise, resistance exercise, and your flexibility. Quickly, HIIT workout, which is basically high intensity interval training. It's just basically a series of intense exercises to help burn fat and build muscle. Basically, it's short bursts of intense exercises for 15 seconds to 2 minutes, followed by quick recovery of about 30 seconds in between. So you're exercising hard, taking a little break, exercising hard, taking a little break, and you're doing this for about 20 to 30 minutes. And 3 to 5 times a week is sufficient. Again, it shows the same kind of benefits as regular exercises at less amount of exercise time. But the disadvantages are the ballistic moves causes more chances for injury and soreness and puts more stress on your muscles. And you always want to check with your doctor before doing a HIIT program. Some barriers to consider. Just remember, lack of time is always an issue, so create a schedule. Motivation, obviously we need that motivation to go, so set realistic goals, like I said earlier. Resources and equipment, choosing your activities, joining communities and groups and programs are always good. Exercising with people that you know always helps. Take advantage of free gyms when you can, when you travel. The weather, when it's hot outside, exercise in the morning or in the evening when the weather is cooler. Well, when it's cold outside, walk indoors. Fear of injury, people get scared of exercising because of injury, so just work out a little easy. Make sure you wear comfortable shoes, use walking poles if you need to. And boredom, that we all suffer from boredom from exercise. Always bring music with you, listen to music, bring a book, watch videos, TV shows. Recruit a friend. That's always good. Talk to someone while you're walking, makes the time go faster. This is someone exercising with boredom here. So tracking devices really quickly. I'm not endorsing any of these, but basically you have Apple Watches, Fitbit, Garmin. They all track heart rate, measures your GPS, the amount of exercise that you've done traveling, how many miles you cover. You have phone apps like Apple Fitness. These are all built into your phones. Most people have cell phones these days. Google Fit if you have a Google phone, and Samsung Health if you have a Samsung phone. And then Strava is an app you can download also, which a lot of people love using. And then you have pedometers, so you can always purchase a pedometer, really easy way to do it to track steps. And those are really cheap to pick up these days. Quickly, just want to talk to you about what we do in cardiac rehab. We monitor patients here. We track EKG, blood pressure, heart rate, and blood sugar for diabetic patients. We monitor for symptoms. We provide exercise prescription for our patients. We help patients warm up and cool down, teach them the importance of that. We do workload progressions to start patients really easy and kind of work people into a much tougher workout to what they're used to. And then we help them create a home exercise program. So when they leave home, leave cardiac rehab, they have a program that they can follow. We also offer education with risk factors, nutrition consult, and also health psychology consult. So key points of my talk here today: wear appropriate shoes, stay hydrated, Listen to your body, report any symptoms or pain to your physician immediately. Treat exercise like a medication prescription. So if you're taking your medications daily, take your exercise daily also. Anything is better than nothing. So even if you can only walk 15 minutes today instead of your normal 1 hour, still better than nothing. Whatever you put into it is what you get out of it. So the harder you work, the more you get out of it. Lifestyle choices and changes in combination with exercise will produce better results. So in combination with the smoking cessation, the diet, and so forth, will all produce better results. And then rest and recovery is just as important as exercise. So no matter how hard you exercise, remember that rest and recovery is just as important. So some favorite quotes that I wanted to share with you today. It doesn't matter how slowly you go as long as you don't stop. Our greatest weakness lies in giving up. The most certain way to succeed is always to try just one more time. It always seems impossible until it's done. I've failed over and over and over again in my life, and that is why I succeed. The only bad workout is the one that didn't happen. And success starts with self-discipline. And the pain you feel today will be the strength you feel tomorrow. So a couple more slides here. I named my dog 5 Miles, so I can tell people I walk 5 miles every day. Cute little dog. And this is probably your local 24-hour fitness. So people going to their workout, taking the escalator up instead of the stairs. So typical, this is, I think, in Beverly Hills. So typical LA. So that is it for my talk today. Thank you for listening. And I will go ahead and take any questions or comments that you may have. Thank you.
Wonderful. Thank you, Richard. That was so informative. I really appreciate you sharing.
Thanks.
We do have some questions here in
Okay.
the Q&A box. Try to get to a few of them before 5 o'clock.
Yep.
Yeah, so a lot of these I think you sort of covered, but maybe we can just quickly reiterate any information that was missed and then anything new that wasn't covered. The first question, does it matter what time of day we exercise? Can a walk late at night be more beneficial than another time, for example?
There's a lot of talk about that. Some people say it's more beneficial in the morning. Some people find it beneficial after a meal. Probably after a meal is fine, but truthfully, as long as you get your walk in, I would go with whatever you're comfortable with. As long as you get your steps in. If you're a night person, go in the evening. If you're a morning person, go in the morning. I think that's more important as to whether it's benefit, you get more benefit during the day or, or after. I think after a meal would be best, but again, as long as you get your steps in the day, I say go with whatever works with your schedule or what you feel that works best for you.
Great, thank you.
Yep.
Next one, I know you went over lots of examples of activities in the presentation. This was submitted prior to, so
Uh-huh.
I'll just go ahead and ask it though. This person would like to incorporate more heart healthy activity, but has a small amount of space at home. Do you have any suggestions specifically for dealing with a small space but getting your exercise in?
Yeah, that's a big issue here in the Bay Area. We don't have space in our room, on our houses. Again, the best way I always suggest is walking outside. Again, if that's not an option because maybe it's too hilly outside or it's not a nice neighborhood. There's things you can buy for yourself. There's these little steppers that I've seen for sale now, where you can sit down on a couch and kind of like a sit down cycle. Doesn't require as much space as a regular bicycle. You can do that. And then as far as actual strength exercises you can do, even just simple sit up and stand up. Those are like squats, just standing up and sitting up on in your chair, doing about, 20 of those, 30 of those. If you have stairs at home, going up and down the stairs, doing several flights of that at a time would be good. So just using what you have available. And then there are, like I said, some stuff you can buy at home for home, like those little pedal machines where you can, it's just a simple bike that you can put right in front of your couch or chair and you can just use that to cycle. That's better than nothing. But again, best thing to do is if it's available, walk outside at home.
Great. Thank you. Those are great suggestions. Um, Next question for seniors 65 and up. What cardio zone should we target?
Again, I would suggest that moderate intensity exercise. High intensity exercise is usually geared towards younger people, although the benefits have been shown for elderly also. But I would suggest a moderate intensity. Now, depending on what resources you have, if you're measuring heart rate as far as a target, again, depending on the medications you're taking, you could use the resting plus 30 or if you have the age predicted maximum heart rate going to that 60% to 80% target zone for heart rate wise. I suggest over here in cardiac rehab, we generally use the RPE scale again, which is that 11 to 14 or 15, which is that moderate to feels like it's somewhat hard to a hard workout. So if it feels easy, speed it up a little, add a little more resistance to kind of get in that green range and then maintaining that level for about a 30-minute to 60-minute workout.
Got it. Okay, great. This next question is related, and you may have gone over this already in the presentation. Can you give examples of the formula of target heart rate in each intensity level?
Yeah, so again, the maximum age predicted heart rate is 220 minus your age. So it's kind of arbitrary again. It's kind of, depending on if you're taking those medications that lower your heart rate, it's not 100% accurate because your heart rate will be lower than what it should be. Again, if you're using that, the target range, the moderate intensity is that 60, 80. 80 to 95% would be the high intensity, and then your 40 to 60 is where the low intensity exercise level is. So the low intensity is really easy, really light, and then that moderate intensity is where your target range is. And then if you're doing those HIIT exercises, that high intensity interval training exercises, you want to go between that moderate to that high intensity back and forth.
Got it. Great. Thank you for clarifying. One more question on the same topic. What's the lowest number on the RPE scale?
Um, Truthfully, the real lowest number, and we use that 7 to 20 range. We don't use the 1 through 10 scale. Um, Truthfully, if you're exercising, the lowest number should be a 9. A 7 is basically the equivalent of just sitting there and not doing anything, just basically breathing. So a 9 is like a very, very light walk. And then as you get to a brisker walk, you're getting up to that 9, that 10, 11, 12. So then it's all opinionated. So as you start breathing harder, you feel like your heart rate's going a little higher, then you start getting into that green range. And then as you start sweating a lot more and that heart rate starts pounding a lot more, you're probably getting closer to that red range, which is above 17. So it's all opinionated. There's no right or wrong, but truthfully, if you start walking at a really low speed, you're probably starting at that 9 and kind of progressing through that 9 scale as you're speeding up or going up
Okay,
hills. Yeah.
great. Thank you. Just a couple more questions. Can regular vigorous physical activity mask heart disease?
Um, that's a tricky one. It can. I've known people who are athletes or athletic people who come in and they're like, I did not see it coming. They'll be running half marathons and so forth. So It can. Heart disease is kind of a tricky thing, especially for women. The traditional symptoms of heart disease doesn't always show up the same way. Um, the chest pain, the trouble breathing, and so forth. The back pain, the left arm pain, radiating pain doesn't always present to everyone. So yes, I mean, as someone who works out more probably doesn't feel it as much. So I think the best gauge for those people is probably a decrease in the ability of the workout. So if you start getting tired more and you're feeling like you're not able to do as much as you were able to do, even though you're not getting the traditional symptoms of chest pain or anything like that, that could be a signal of that having issues. Um, and then, if it's someone who just has a history of family history of heart disease, it would probably be a good idea just to have a stress test occasionally, maybe in their early 40s, just to kind of clear yourself of that issue. It's always hard to track heart disease, and especially in athletes, as you can, as people know, you got these marathon runners who get to the finish line and they collapse. And, who knows if they're really having symptoms or not, or if they were masking it, or they just didn't realize it. So it's always a tricky subject.
Yeah, totally. Thank you for
Sure.
sort of providing some clarification, though. That makes a lot of sense. Okay, we just have two more questions. Maybe we can
Sure.
get through them
Uh-huh.
quickly. If exercise dilates blood vessels, does that mean that it can slow down the hardening of arteries or the sort of process of the
It
arteries
won't,
hardening?
sure. It won't slow down the hardening of the arteries. What it does is it does help the arteries kind of dilate, and so it's helping that the way that the blood vessels work. So it's kind of like exercising your blood vessels. The hardening of the blood vessels, or the plaque development, is from cholesterol and all of that kind of over time. Um, as I said earlier, HDL, building up that HDL to get rid of the LDL, um, that prevents that plaque development in the arteries. So exercise does help in that way. It doesn't help in keeping the the arteries from stiffening, but it does help with elasticity. So I guess it kind of helps with that. So it helps with that elasticity in the blood pressure, but it doesn't help ultimately in making it like the hardening of the blood vessel itself or within the inside of it.
Right. Okay. Great. That makes sense. And our last question, I think you sort of went over this in the presentation already, but is pain after exercise but not during it a sign that we've done too much?
So you never want pain. So pain after exercise is usually not a good thing. Soreness is fine. So there's a big difference between pain and soreness. So pain is to the point where you can't walk, you can't move. That's not good. So a little soreness is a good sign of, yes, your muscles are working out. Um, they're kind of angry at you for working out, but that soreness should go away after a day or two. And as you start exercising more, the amount of soreness should improve as you go along. So someone who's never exercised before or exercises at a low level, as if they start exercising more and more, I think the soreness will show up in the beginning and it should improve as it go along. But if you start getting pain and it's to the point where you can't get up in the morning, or like your back hurts or leg hurts where you can't do anything the next day, that's not a good thing. So you're either pushing yourself too much, or you might want to talk to your doctor about that.
Got it. Great. Thank you for making that
Mhm.
clarification.
Yeah,
Yeah, I know we're a couple minutes over. Thank you so much for taking the extra time to
yeah,
answer
that's no
our
problem.
questions. I just wanted to thank everyone for joining this presentation hosted by the Kanbar Cardiac Care Center. Thank you, Richard, for taking the time out of your busy schedule to present on such an important topic. Um, we do have a new feature of our health education events, so you will see a survey pop up when you close out the presentation. We really appreciate your feedback. So if you have a minute or two to fill out that survey at the end or when we close out the presentation, please do so. We'll continue to host these presentations roughly bi-monthly, so definitely keep an eye out for more email invitations for upcoming events. Thank you again, everyone. Thank you, Richard. I hope everyone has a great evening.
Thank you, everyone.
Take care.
Bye.